Hi everyone. In this video, we are going to look into hospital and health profession in society. Myself, Dr. V. Sofia Declameri, Assistant Professor in Head Department of Sociology and Social Work, FATIM. Hospital and health profession in society. The study of hospitals and health professions very important in recent days in today's context. Why? Because people have become health conscious as well as the hospitals numbers have increased. Uh, those days we could see hospitals here and there, but in today, uh, wherever we go, we can see different hospitals are available, especially the specialty hospitals are very visible in recent days. So, it is the need of the hour that we need to look into the hospitals and the health professions in the society and their contribution. So, the study of hospitals and health professions are highly helpful in analyzing the healthcare providers not just merely as technicians but as social institutions and professionals operating within and shaped by broader societal structures. So, hospitals are viewed as complex social systems that function as workplace bureaucracies and agents of social control. Undoubtedly, in today's context, hospitals are highly viewed as complex social systems. Uh, there are a lot of technicians, assistants are being recruited in the hospitals, bureaucracies and agents of social control. The hospitals are also being identified as the agents of social control. So, in the key aspects of the hospitals are the hospitals are identified as a social institution. When you say social institution, as institution, we know that it has its own rules and regulations. It has its own symbol. It has its own way of carrying out the activities. Similarly, hospital also identified as a social institution. So the evolution of hospitals are evolved from early charity based. In the beginning, we didn't have hospitals. We had religious or early charity based services are offered to the people who are sick, and religious based the Christian missionaries, they contributed a lot, and they were taking care of the poor, dying, destitutes, and the sick people. Then what happened? Modern and high, there are high centers or highly um, technical oriented centers for diagnosis, teaching, and treatment are being established, and people have slowly started to move on that, and people have started to give more importance to their health. Social structure and organization. The modern hospitals are characterized by a fine division of labor. As we know, division of labor is people are being categorized or divided into different level of employees based on their qualification and experiences in order to reach out the public to offer quality services at the same time to reach out a large, that is quantity of patients can be reached out through this division of labor. Then complex bureaucratic structures are also being developed. So in the hospitals you can see the uh, higher qualified or educated persons are being at the topmost bureaucratic or in the order higher order employee category. Then the middle level, the people who are comparatively less qualified uh, from the doctors, like who are assisting them, they'll come under the middle level, and they have lower level who do or does the menial jobs, assisting them, cleaning, um, removing the wastages, discarding those disposals, etc., etc. So often in the hospitals, you can see very clearly the complex bureaucratic structures are being followed, and they describe that as a matrix organization, which blends the professional autonomy with hierarchical administrative control. So that's why they call it as matrix organizations, where both the professional autonomy will be exercised, at the same time they will be under the hierarchical administrative control. So they have been monitored, they have been regularized through the norms, and they have been controlled by their hierarchical administrative bodies. So hospitals are also as social words. They have been identified as social words. Each hospital has its own unique personality, work culture, and emotional atmosphere. As we know, hospitals are the service sector, but in today's context, they are also being identified as an industry. So each hospitals has their own way of receiving the patients, diagnosing them, offering treatment, and operations based on the first, second, and third opinion. So they have their own way of executing their work. And the work culture also, each hospital has its own work culture, and their emotional atmosphere also varies from hospital to hospitals. We cannot say uniformly all the hospitals are following the same work culture and they are offering the same emotional atmosphere to their to the patients as well as the employees who are working in the organization. So then, class and social structure. See, when you take the class and social structure in the hospital, hospital wards, they have public, semi-private, they have private rooms, which reflects the class divisions of the wider society. So in today's context, in the hospitals, you can see the distributions of patients and the money, how much they have. Based on that, the wards have been designed and it has been offered to the patients. If they are able to pay, they have given well furnished rooms. Middle class are given the middle level payment oriented rooms. Then lower level people who are not able to pay the fees and rent, etc., they are given less furnished rooms and equipments. Then the hospitals are also being identified negative social impacts. Uh, Beyond the care, hospitals can also act as an agent of exclusion due to ways can be direct policy. Many hospitals, they are good in offering the services, but they do concentrate in a minimum level in order to discard the wastages, the medical waste, like bandages, then injections, syringes, bottles, then glucose bottles, and all the trips, whatever they are using in the um, daily diagnosis or treatment or in the operation theaters. All those wastages are not channelized properly, or it is not reused, or it is not concentrated on reusing those wastages and how to utilize it in a proper way. So this has to be focused on. And the class and social structure in the hospital, it is the reflection of the society where we have the hierarchical order based on the caste and class. In hospitals we don't have caste but class. Based on the class, the treatments are also offered to the patients based on it. So I would like to thank you for listening to me patiently in this video. Thank you.